I'm Staff Sergeant Stephen Still from the Defence Medical Academy. In this lesson we're talking about patient safeguarding. By the end of this lesson you'll be able to discuss safeguarding adults in the healthcare setting, discuss generically abuse, how to deal with abuse and how to report it, and you can explain the relevant legislation. Safeguarding adults is the safety and well-being of all patients. Additional measures for those less able to protect themselves from harm or abuse, and it is integral to complying with legislation, regulations and delivering cost-effective care. An adult at risk is any person who is aged 18 years or over and at risk of abuse or neglect because of their needs for care or for support. Abuse can either be verbal, sexual, physical or psychological. If you do not report abuse, you are as guilty as the abuser. So the legislation which covers this are the Care Act of 2014, the Mental Capacity Act and the Human Rights Act of 1992. So the Care Act of 2014 sets out statutory responsibility between health and local authorities. NHS England and clinical commissioning groups work in partnership with social care services. Local authorities have statutory responsibility for safeguarding. The Mental Capacity Act protects and empowers people who may lack the mental capacity to make their own decisions about their care and treatment. It applies to people aged 16 and over. It covers decisions about day-to-day things like what to wear or what to buy for the weekly shop, serious life-changing decisions like whether to move into a care home or have major surgery. Some examples that are covered in the Mental Capacity Act are dementia, severe learning difficulties, injuries such as head injury, illness such as stroke and unconsciousness. The Human Rights Act of 1992 covers a number of topics which range from the right to life, the prohibition of torture, prohibition of slavery and forced labour, right to liberty and security, right to a fair trial, no punishment without law, respect for your private and family life, freedom of thought, conscience and religion, freedom of expression, freedom of assembly and association, right to marry, prohibition of discrimination, protection of property, right to education, right to free elections, and finally the abolition of the death penalty. In summary, you can now discuss safeguarding adults in a healthcare setting. You can generically discuss abuse, how to deal with abuse and how to report it, and explain the relevant legislation. Here are some references for further reading.